isn't over yet. COVID, the second wave.
You're watching this special segment with me, Nabila Jamal. It's a special COVID-19 coverage. India is currently battling the second COVID wave amid reports of the double mutant variant cases on the rise now. Now, about 80% of the new COVID cases are from 6 states, the worst hit being Maharashtra. Here's a report on what is really causing this sudden surge in Maharashtra.
As 2021 began, India was thought to be slowly seeing the back of COVID-19. Cases had fallen drastically after the surge in September 2020. The surge across 6 states confirms fears of a second wave in India. Over 80% of new COVID-19 cases in the country's second wave are from Maharashtra, Punjab, Gujarat, Chhattisgarh, Karnataka and Kerala, according to the Ministry of Health and Family Welfare. Maharashtra, Punjab, Chhattisgarh, Tamil Nadu, Karnataka and Kerala are also accounting for over 80% of deaths from COVID-19. What is then fueling this surge? Is it COVID inappropriate behavior alone? The government insists this surge is mostly because of careless behavior and more opening up. Experts say a second wave in the life of a virus is natural, but we need not be helpless.
We must stop the virus from spreading, causing large clusters, and it is within these clusters that these variants will emerge. When a large number of people have a lot of infection, many mutations happen, and only the best get selected as variants. The best from the viewpoint of the virus. So let's continue with every social distancing measure, continue to use masks, get ourselves vaccinated as quickly as possible.
To make it worse, the government has confirmed cases of variants, including a double mutant, 223 infections of which has been seen in various states in the country.
Countrywide, there is genetic mapping which is going on, and INSAGOG is the name of this initiative, and that is being supervised by NCDC. Predominantly, the older circulating strains and the newer variants have just been identified and are being mapped.
The government has also confirmed that variants from Brazil, UK and South Africa are spreading. Experts say genome sequencing to check for mutations is key to finding the variant that is wreaking havoc.
The way forward is to ensure that concurrent evaluation of the clusters which are developing in different parts of the country are immediately investigated for genetic sequencing and understand which variant of concern is in circulation locally. It is very important to prevent the spread of these variants of concern from one area to another to ensure that it doesn't become a major problem in the country.
Genome sequencing experts say need to be done on a war footing in India. At present, just about 5% samples of the total samples positive are sent to test for new variants of the infection. This is not good enough, is what many experts suggest. Moreover, the State Bank of India in a report has said that the second wave of this infection possibly will last for 100 days starting from the 15th of February. But this time, India is better prepared. And vaccination certainly picking up pace on the vaccination drive is undoubtedly the way forward. In New Delhi, Sneha Murdani for India Today.
Now, the question here is, what is this scare about the double mutations, and is it really leading to more infectivity? Sneha Murdani addresses all your queries right here in this explainer. Let's cut across.
New variants, double mutant variants leading to a spike in cases in India. Will they be killing more people? Lots of questions around what this new added headache of mutating viruses really mean for the country in its fight against COVID-19. Firstly, it is natural for viruses to mutate. Simply put, it is a change in form, change in the basic structure of a living being. They mutate to form new variants. So if it is a new variant, it is a mutated virus. Globally, there is a hunt to look for new variants of coronavirus because the new variant may or may not respond to the vaccine. A mutating virus can mutate to harm more. It can cause more infections. Sometimes it can cause more severe disease. Hence, it may kill more. Often, it may lead to reinfections as well. Well, there is some science to suggest that the current mutations might not be fatal, but they certainly spread faster. In India, more than 700 mutations of 3 variants, the Brazil variant, the South Africa variant and the UK variant have been reported. It has been found in 18 states in total. These are variants of concern of VOC. These comprise 736 samples positive for viruses of the UK variant, which is the B.1.17 lineage, 34 samples positive for viruses of the South African variant, which is the B.1.351 lineage, and 1 sample positive for virus of the dangerous P.1 variant, which is the Brazilian variant essentially. The government says that both Covishield and Covaxin are effective against all of these variants that we're seeing in the country. But this is disputed. India is also seeing double mutation. So what really is double mutation? When 2 mutated strains of a virus come together for a 3rd strain, it is called double mutation. The one reported in India is the result of the E484Q and L452R strains combining. A double mutation potentially allows the virus to escape from the body's immune system and make itself more resistant to our antibodies. In some cases, the virus can also defend itself from the vaccine. All of this, of course, depends on which 2 strains actually combined. It appears double mutations are leading to more infectivity, and also this type of mutation confers immune escape, which means that a mutation that offers the virus the ability to evade attack by antibodies.
All right, let's now take a quick look at how the states are battling COVID. First up, Maharashtra, currently the worst hit in the country. It is seeing its highest daily case spike since the pandemic began. Let's take a look at this ground report.
Maharashtra is right in the middle of a second wave of COVID-19. The state broke its own pandemic record after it reported over 35,000 new cases on Thursday, taking its active case tally way past 260,000 mark. The magnitude of the crisis is evident from this one statistic. The state alone has nearly 60% of the entire country's active caseload. India's financial capital, Mumbai, recorded over 5,500 cases on Thursday, the highest since the outbreak of the pandemic. With the latest surge, Pune remains the district with most active cases, that is over 50,000. Nagpur district comes second with over 35,000 active cases, followed by Mumbai with over 32,000 active cases. In a bid to manage the curve, the BMC has started random antigen testing at markets, shopping malls and crowded places.
If you're entering a mall in Mumbai, then you need to have a negative RT-PCR report. If you don't have that, then perhaps you could be subjected to a rapid antigen test. Such kind of arrangements have been made at most of the crowded places in Mumbai, and BMC says owing to the increase in testing, the numbers are also showing an increase.
They should make it, if it is compulsory, then they must make it free.
It's a good move, but again, you can't charge because not everybody in India can afford this. So when it comes to charging for this, it's not a good idea. And what if it comes positive? There are good chances of false negative, then they have to go for RT-PCR.
But with virus spreading like wildfire once again in the maximum city, revelers aren't happy.
नहीं बताया तो नहीं किसी ने, हम तो आज ही आए हैं यूएस से। ओके। तो आज ही आए यूएस से, तो हमारा तो मतलब 72 आवर पहले का जो टेस्ट है तो वो तो नेगेटिव है।
टीचर्स पे अभी एंटीजन टेस्ट करवाने का ऑर्डर दिया है बीएमसी ने।
एंटीजन नहीं, हमको कैसे मालूम भैया, हम तो आज आए हैं इस देश में।
The good news is Maharashtra is now the #1 state in terms of COVID vaccine doses administered. It also became the first state to cross 5 million doses of anti-COVID vaccine. With Mustafa Sheikh and Pankaj Upadhyay in Mumbai, Bureau Report, India Today.
All right, we have some big news coming in. Maharashtra Deputy Chief Minister warns of a lockdown if the COVID cases continues to rise at an alarming level. Nearly 1 lakh cases in 3 days have been reported in the state. We're going to monitor. In fact, this is what exactly the Chief Minister has said. We are going to monitor corona cases in the state until the 2nd of April. If we observe that people are not following social distancing norms, then the government won't have any option and we might go for a lockdown. Now, coming up next is Delhi. It recently recorded its biggest jump in coronavirus cases since December 18th of last year. In fact, the capital city has already witnessed 3 waves of the COVID-19 virus. Now, is it prepared to handle the 4th one? Here's a report on that.
One year since the national lockdown, Delhi still remains vulnerable to COVID-19. The national capital has been witness to 3 waves of COVID-19 virus. In July 2020, Delhi witnessed a massive surge in cases. Hospitals were inundated with patients. The second wave came in September. The third one came in November, post-Diwali, when Delhi eclipsed cities like New York and Sao Paulo with daily cases of more than 7,000. But soon the peak was behind us.
मैं डेफिनेटली आपसे कह सकता हूं कि दिल्ली की जो थर्ड वेव है, फर्स्ट वेव जून में आई थी, सेकंड वेव सितंबर में आई थी और थर्ड वेव ये जो नवंबर में चल रही है, इसका पीक तो जा चुका है। आज मैं कह सकता हूं, डेफिनेटली आपसे कह सकता हूं कि डेफिनेटली वेव का जो पीक था, पीक इज गॉन। अब धीरे धीरे ये कम आएगी।
Is Delhi better prepared today? Because the city is once again witnessing a surge, recording more than 1,000 cases in the last few days. Deaths are also on the rise. But today we have a vaccine. Yet Delhi has vaccinated only over 3% of its population who have taken just the first dose. Delhi Chief Minister has appealed to citizens to take the vaccine. Fearing another wave, Chief Minister Kejriwal has also put a curb on Holi, Shab-e-Barat, Navratri and Easter festivities in public. The lockdown was a severe blow to businesses, many of which cannot suffer another jolt.
वैसे ही ये 6 महीने मार्केटें बंद रही, बड़ा लॉस हुआ, लौट आई जिंदगी भी अब पटरी पे जाके। और जब तक ये नहीं कि दवाई आ गई अब ढलाई होगी, जब तक देश से कोरोना खत्म ना हो, सरकार का सहयोग करिए और बिना मास्क के कोई मार्केट ना आए।
Delhi Chief Minister has ruled out another lockdown, but the government continues to closely monitor the situation.
The fine for not wearing a mask in Delhi is still rupees 2,000. But now COVID fatigue has set in, with many people not complying to wearing a mask or following social distancing norms. In markets such as these, crowds continue to swell as cases in Delhi also breach the 1,000 mark for the second consecutive day. With Ajay Thakur, Milan Sharma for India Today.
Now, Karnataka has also seen a spurt in COVID cases recently. It witnesses over 2,500 cases on Thursday. Bengaluru is currently among the 10 worst hit districts. Let's take a listen at this detailed report from Karnataka.
Fear is rising in Karnataka as COVID cases soar again. 2,500 cases in the last 24 hours is very worrying. But that isn't the only concern. India's IT center, Bengaluru, is in the list of top 10 districts with the highest number of active cases. Hedged between the high COVID prevalent states like Maharashtra and Kerala, Karnataka sees a lot of incoming traffic, particularly to Bengaluru. On Thursday, the Karnataka government announced that everybody entering the state will have to carry an RT-PCR negative certificate.
Sudden increase in the cases has to be blamed on ourselves. That is, our people slowly started forgetting the safety measures which had to be taken. They thought that corona has gone, vaccination is on the way, so we can be back to our normal life.
The state government has blamed the complacent attitude of people for the rise in cases. But authorities in turn have also been found wanting. The vaccination drive in the state has been slow, with just 30 lakh people inoculated so far.
Regarding the vaccination supply, there will not be any disruption as far as Karnataka is concerned. He will ensure, it depends on the number of inoculation, they will be continuously supplying us with the vaccine. So we need to scale up our IEC, motivate people and ensure that more number of people above 45 years will come to facilities to take the vaccines.
Opposition parties say that the Yediyurappa government continues to show how ill-prepared it is in dealing with the crisis.
It is definitely a massive failure that, first of all, cases are not being reported. Second, why is that, you took so long to actually kind of expect this surge? The government should take this seriously and stop more people from getting affected and stop more deaths as well.
The state government has reimposed some restrictions to curb the spread. As of now, the cases in Bengaluru and elsewhere are manageable. But with several festivals coming up, the concern is that there is every chance of the situation going out of control. With Nagarjun Dwarkanath and Nolan Pinto in Bengaluru, Bureau Report, India Today.
Now to a state now that is the flavor of the season, West Bengal indeed. Massive poll campaigning on in the state, but all COVID norms thrown to the wind. People and politicians are seen violating basic norms. Let's take a look at this report.
High voltage poll battle in Bengal. TMC or BJP, everyone is talking about politics. But what about the pandemic? Zero social distancing at TMC and BJP rallies. No social distancing, hardly any masks, and zero apparent care for a pandemic that has just begun to surge again in India. Take a closer look at these hair-raising images. All this at a time when India is fighting to ensure a second wave doesn't overwhelm the country. Doctors and healthcare experts have once again warned against letting down of the guard.
COVID is going to stay with us. It's not that very easily it is going to leave you. In Bengal, we can see last 7-10 days mostly that the cases are increasing a little bit. The population participating in this election and those who are not covered with the mask, they are not using masks, no sanitizer, no social distancing. So we are expecting that that's a huge number is going to come up in a very number of days' time.
Bengal is currently battling over 3,500 active cases. The only good news? The COVID-19 vaccines and many senior citizens who are queuing up to get the jab.
আমাদের নিজেদের স্বাস্থ্য রক্ষার জন্য এই ভ্যাকসিনটা আমরা নিচ্ছি যাতে আমরা কোনো সংক্রমিত না হই। I expect that we will be benefited by this.
As polls and politics take center stage in Bengal, the pandemic and the fight against it have been put on the back burner. The big question is, could it prove costly in the long run?
The COVID-19 situation in West Bengal might not be as alarming compared to other states. However, the recent surge in COVID cases has made hospital authorities sit up and take notice. And with close to 4,000 active COVID-19 cases in the state as of Thursday and 516 new cases, the authorities are not taking things very easily. With camera person Raknam Das, Prema Rajraman, Kolkata for India Today.
Now, the number of coronavirus cases in the country are on the rise, and so are the number of COVID deaths. Amid the poll and festive season here, there is no stopping crowds and gatherings. At many places, people are seen playing with colours, gulal, as if immune to COVID-19. In fact, COVIDiates were even seen during the protests across the nation amid the Bharat Bandh call given by farmers. Now, we urge every citizen to keep their masks on, as the battle against COVID is certainly not over.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.